My name is Shrey Muthu, and I'm a senior in the biology program, and this is my senior capstone presentation. My topic is the opioid epidemic and the urgency to explore alternative pain treatment. So first, to provide a little bit of background on what opioids are. So opioids are pain-relieving drugs that are often prescribed to treat chronic pain. So how do opioids get in the hands of people? So either they're prescribed by a pain management physician with the appropriate credentials, or they are purchased illegally on the street. They're derived from the poppy plant, this purple flower, and opioid drugs bind to opioid receptors. There are many different kinds of opioid receptors: nociceptin, delta, mu, and kappa. When opioid drugs bind these receptors, they alter a person's perception of pain and create a feeling of euphoria. So some opioids that you've probably heard of include codeine, fentanyl, hydrocodone, or methadone. Maybe you've been prescribed one of these after an intense surgery, or maybe you've heard about them on the news. They've gained a kind of a notorious reputation because of the huge number of deaths that they've caused. Opioids kill. So the opioid epidemic has been such a major problem for decades. The entire medical community has to come together in order to combat the problem. It's still such a major problem. And it's a struggle for physicians and patients alike. This is a graph created by the Centers for Disease Control and Prevention titled National Drug-Involved Overdose Deaths Number Among All Ages 1999 to 2019. And I wanted to provide a little bit of commentary on why this rising number of deaths is not surprising. So one example I found in September 2020, the FDA warned 17 different websites since they were selling opioids to customers without a prescription and not warning consumers about their addictive properties. So when doctors prescribe an opioid, they will counsel their patient, they will perform periodic drug screens, and just kind of have certain measures and kind of check in to make sure that these opioids are not being misused. However, there's still, even when doctors prescribe opioids, there's still such a huge number of deaths. So imagine if these drugs are being made by non-pharmaceutical companies and the side effects of these drugs are unknown. Imagine how much more dangerous that makes them. Another drug at the forefront of the opioid epidemic is fentanyl. So fentanyl has gained a very notorious reputation. Over 50 years ago, doctors would use fentanyl as an IV surgical analgesic. And fentanyl is being made by drug cartels, street gangs, and they mix it with other street drugs to try and create the most addictive concoction to make sure that they have a steady flow of customers, a steady flow of revenue. And the potency and danger of synthetically made fentanyl made by these drug cartels, could even probably apply this to street gangs, is impossible to quantitatively and certainly determine. There was a 92% increase in fentanyl seizures last year, and this number is continually going up. Like we see on this graph, the number of opioid-related overdose deaths is continually going up. So for the scope of this presentation, we're going to look at the 3 phases of withdrawal: 6 to 12 hours, 48 to 72 hours, and 10 days. So why does withdrawal happen? So as little as 5 days after a person begins taking a drug, they can develop a dependence on that drug. But why? So when you take opioids for chronic pain, you start feeling euphoria after taking that drug. And the reason is because the drug triggers a dopamine reward response. And on an anatomical level, this is the mesolimbic system within the brain. So let's say you got a raise at work, your mesolimbic system would be affected by that. Dopamine accumulates with taking opioids, and dopamine accumulates with taking opioids, and the region where it accumulates is the nucleus accumbens. So the brain associates the surges of pleasure with taking opioids, and these are known as conditioned associations. Usually a person who misuses opioids will do so in the same environment, in their bedroom, in their closet, whatever it may be. And when they put themselves in that environment again, they feel the urge to abuse that opioid again. This becomes a kind of a conditioned pattern. And as a person continually abuses that opioid, their tolerance increases. They need more of the drug to experience the same high. As their tolerance keeps increasing, it increases their likelihood for dying of overdose because they need such a high amount of the drug to experience a good high. So let's look at the withdrawal symptoms 6 to 12 hours. Fever, muscle ache, nausea, tachycardia, fast heart rate. 48 to 72 hours, cravings, relapse, insomnia, lack or inability to sleep. 10 days, decreased energy and lack of motivation, diarrhea, and depression. So why does the body have these symptoms when a person is going through opioid withdrawal? The body is trying to get back to its normal baseline function, its normal function where a person was not abusing opioids. And if a person recognizes they have an addiction to opioids, they should seek medical help because they shouldn't have to go through these symptoms alone if they just try and quit cold turkey, for example. So now the main focus of this presentation, the power of naturopathic medicine. Naturopathic medicine is a distinct healthcare profession that combines the wisdom of nature with the rigors of modern science. The key values or core values of naturopathic medicine include the healing power of nature, treating the whole person, and prevention. First alternative to opioids we're going to discuss is capsaicin. It's derived from chili peppers. It's used as a topical form of painkiller, and it works by affecting the start quote, synthesis, storage, transport, and release of substance P, which is believed to be the principal chemical mediator of pain impulses from the peripheral nervous system to the central nervous system, end quote. That was by Salgugian, 2009. Next alternative we're going to discuss is turmeric. So the principal ingredient in turmeric that contributes to being a pain reliever is curcumin. Curcumin is an antioxidant, so it basically reduces the reactive oxygen species and free radicals that contribute to or cause oxidative stress. And oxidative stress causes inflammation, and inflammation is one of the results of chronic pain. So the next one is MSM crystals, aka methyl sulfonylmethane. It's a dietary supplement used to treat chronic pain. It's derived from an organic form of sulfur. The safety, however, of MSM crystals and the long-term side effects or long-term effects of it are unknown at the moment. And the way that the dietary supplement works is by inhibiting a transcription factor of B cells, and B cells are involved in the inflammatory response. So inflammation is often a cause of chronic pain, and MSM reduces cytokine expression. Cytokines are produced by T helper cells, which are involved in inflammation. Next alternative we're going to discuss is ginger. Ginger has a pain-reducing effect. It can modulate pain through various mechanisms, inhibition of prostaglandins via the COX and LOX pathways, antioxidant activity, inhibition of the transcription factor NFKB, or acting as an antagonist of vanilloid receptor. So cyclooxygenase is a precursor to prostaglandins, which is also involved in the inflammatory response. Inflammation being a key cause of chronic pain. Next one we're going to discuss is borage seed oil. It contains a fatty acid, gamma-linolenic acid, and it also has anti-inflammatory properties. However, the efficacy of borage seed oil is questionable. Boswellia, aka frankincense. It inhibits pro-inflammatory enzymes. It also inhibits leukotriene synthesis. Leukotrienes are also involved in inflammation. Medical marijuana. The human body has an endocannabinoid system, which is made up of a family of G proteins. Certain molecules in THC and CBD bind to the G proteins, and the endocannabinoid system mediates pain. So a key theme between all of these alternative pain treatments is that they inhibit inflammatory responses, either through neutralizing free radicals, inhibiting or reducing cytokine expression, inhibiting pro-inflammatory enzymes, many other mechanisms. But considering the severity and number of people dying from opioids, the need to explore these treatments is urgent. Thank you for listening to my presentation. That is it.